all the resources and labor had to go to supporting our ICU patients. So we stopped our elective surgeries and focused on the emergent surgeries, our trauma surgeries, and made sure that the cancer surgeries got done.
As hospitals in Ontario filled with COVID-19 patients, for a while, non-emergency surgeries and non-urgent procedures were put on hold. Now healthcare teams are scrambling to catch up.
But even though we are down by 2 or 3 operating rooms per day, our volumes are still as high as they were just by tightening everything up.
The pandemic has created a staggering backlog of the healthcare system in Ontario. The Ontario Medical Association says there are 20 million backlog healthcare services as a result of COVID-19. That includes surgeries, diagnostic tests, and doctor's visits.
With the assumption that doctors would work at 120% of capacity, which is frankly an unsustainable rate. But using that rate, we know that there are 30 months worth of wait times for knee replacements. It's 20 months for a hip replacement.
In an effort to ramp back up quickly, healthcare teams have had to be creative. The obstetrics and gynecology department at Humber River Hospital created an outpatient hysteroscopy clinic.
And what that allows us to do is to diagnose and treat certain medical conditions leading to either abnormal uterine bleeding, postmenopausal bleeding, or infertility.
Providing the same type of care, just not in an operating room.
Which allows us to open the operating room for larger cases that are on our wait list now because of the pandemic.
This patient of the clinic feared she may have been experiencing the same symptoms of endometrial cancer her mother had.
It was nice to see that I could be seen quickly, because I had trouble actually even finding a gynecologist for about a year, and having to suffer through symptoms is definitely not okay.
Cutting through the COVID-19 bottleneck will be time-consuming, but Dr. Stephen Hallman says collaboration and innovation will help.
January will get us up to 100% of where we were pre-COVID, but then at that time we'll be able to probably closer to 110 to 120% of where we were.
Caryn Lieberman, Global News.